House to try to reapprove the coronavirus package that was passed early Saturday morning after technical changes had to be made. They would try to do that by unanimous consent. All it would take is one objection, though, to block it. The Senate, meantime, they can't start to work on the bill until the House, as I said, kind of repasses it and sends it across the Capitol. So that's what they're dealing with in Washington, as people all over the country wonder why it's taking so long. Essentially, that's why. Republican Senator John Barrasso, Wyoming, joins us now. Senator, what's your level of frustration with how this is all playing out? And tell us what you would like to see once it does play out. What are your top priorities? Again, to go back to what Dan Henninger was just talking about in helping people so that we can kind of, quote unquote, flatten this economic curve as well.
Well, number one, in addition to being a U.S. Senator from Wyoming, I'm also a physician,
yes,
practiced medicine in Wyoming for 25 years. And my focus, as the president's was today, is on the virus and the health and well-being of the American people. We took the first step in Congress by passing legislation to make sure that the doctors and the hospitals had the resources that they need, and the president was right to focus on the disease. As he has said, and others, until we get the health aspect of this behind us, the economy will not recover. In terms of what Congress can do now, and I'm waiting for the bill to come from the House to the Senate, they need to do some revisions. I want to do something that is targeted and timely and will focus on the people that need it most.
Who are those people specifically? Is it small business? Is it individuals? Is it a combination of the two? And I guess the other way maybe to ask it is, who gets left out there? Are you leaving out some of the big businesses who you think can kind of shoulder this and have the capital kind of work their way through it more effectively?
Well, from Wyoming, I'm thinking of the small business owners I was talking to this weekend. Susan Bosco, Bosco's Italian restaurant. I've been going there for 37 years. She always takes care of her employees. And the question is, if they have to shut down because of some constraints on who can go and businesses and restaurants that can be open, how are those employees going to be taking care of themselves? So I'm thinking about those working families.
How do you do it? What's the mechanics?
The families.
How does it work?
Yeah, that's the key issue, and I know there are a couple of Republican senators who are saying what the House has passed doesn't go far enough, fast enough. You want to make sure there is actually money in the pockets of those people without putting additional burden on the small businesses, because you want those businesses to still be viable and open up again when the country opens up for business after we get the health care crisis behind us.
Is it some sort of a special lending facility, as was just discussed, which would have to work its way through the Federal Reserve, most likely, be authorized possibly by the Treasury Department, or does the role that you play in the Congress become more important, and there's something Congress must do directly, or possibly a combination of the two, Senator?
Well, I think Congress can do it directly. We need to do it quickly. We need to go, I believe, further and faster than the House bill, but do it in a way to make sure the money is actually in people's hands, people that have had withholdings through Social Security. We know who they are. Get the money directly to them without an additional burden on the businesses. And that's the concern I have. You know, 70% of all the employees in the United States work through small businesses. And in Wyoming, I think it's just about 100% of the workers in Wyoming work for small businesses. So we need to make sure that those families, and I agree with everything the president's doing in terms of saying 14 days off. If you need to quarantine yourself, take care of somebody else. If you're sick, don't go to work.
Understood.
The focus has to be, as the president has said today, on stopping the spread of the virus. That's the way we keep the total number of cases down. It's the way we don't have the big surge on our medical communities and the hospitals and the respirators.
But by definition, Senator, that hurts the economy, right? So timeline, really quick before we let you go, when will you have this bill passed by? Do you have any idea?
Well, I would like to get that done today. It's not likely done today, but it will be done this week, and we need to get the bill from the House so we can work on it in the Senate. We're going to have a leadership meeting this evening, meet with more senators tomorrow, be on the floor of the United States Senate tomorrow.
By tomorrow. All right, Senator Barrasso, thank you very much for all the time today, and we'll check back on Capitol Hill. Adam Lashinsky now from Fortune with a